Welcome back to another episode of the Life Sciences Professional Podcast. Today I have two great guests with me, Dr. Freund and Dino Vlahavas, and they are from a group called the Chrysalis Group of Dental Businesses, and they will tell us a lot about what they have done to really differentiate themselves in the dental industry. Please welcome Dr. Freund and Dino Vlahavas. Well, thank you, Dino and Dr. Freund, for joining us today. Dino, you and I have worked together for many years, and but I feel very privileged, Dr. Freund, to get the opportunity to chat further with you and get to share your career journeys and what you're currently doing at the Chrysalis group of businesses. So before we get started, other people don't know you like I do. So just wondered if each of you could just briefly introduce yourselves and just tell our listeners a bit about you, if you don't mind. Who would like to go first?
Thank you for having us. Absolutely.
Yeah.
Pleasure. No, go. Linda, obviously you and I have known each other and worked together for probably close to 13 years now in the dental industry. My background is in sales. I've spent the last 13 years prior to joining this amazing team facility with Straumann Group Canada, regional sales director for both Ontario, Manitoba, Saskatchewan. I had the luxury of working with some of the best sort of salespeople, if you will, in that industry. And thanks to you and your organization and your help helping me find such wonderful people over those years has been nothing short of amazing. But most recently, I've joined here with Dr. Steve Bongard. My role now is VP of Operations and Managing Partner, both for Chrysalis Dental Centres, Genesis, the global training and education for dental practitioners and their teams, and also Build Technology, which I can get into a little bit later on as well. But happy to be a part of this. Thank you for having us, and that's a little bit about myself.
Great, thank you.
Linda, it's a pleasure. Thank you so much for the opportunity. As you said, I'm a little bit different. I've been with the team here for about 5 years now. My background is both as a physician and as a dentist, and I've specialized as an oral and maxillofacial surgeon and have been in private practice for about 20 years before joining this group. My interests have always been diverse in the sense that it's been important to look for better ways of doing things and justifying them. So clinical research has always been something that I've had a passion for, and I've had the ability to bring it here to Chrysalis and to couple that with teaching. So overall, at the moment, we are initiating a very intense research program and bringing that in as part of a global teaching initiative so that the benefits that we get out of our research can be translated into better health care through all of our colleagues.
It's fantastic. And, so I hope that we can share some of the information about both of you and what your unique backgrounds and skills and experience that you've been able to bring to the Chrysalis group and what's been their differentiator and what they're trying to do in the marketplace and help best practice and improve patient care. Overall, that's been the goal, and helping dental practices also, be different in terms of the practices that they have out. And so Dino, I think, what might be helpful, because you touched the three different businesses that the Chrysalis group has. So could you just touch on that in terms of what your role is and those unique businesses that you're responsible for? Do you mind?
Absolutely. So again, my role and responsibility is sort of overseeing operations of all three divisions. So division one and the people, of course. People is sort of my forte, if you will. I think that. But Chrysalis is a an offering for patients out there that is strictly dedicated to all things dental implants. At the clinic, for over 25 years, Dr. Stephen Bongard has perfected the sort of journey and solution offering of being able to provide patients with a dental implant or implants, depending on the case, of course. Same day surgery followed by a temporary set of teeth on that day as well. And this is something that we sort of, as we say, this is our lane of offering. We typically stay in that. We don't offer any other sort of dental treatments. For example, hygiene, we stay away from sort of the offering of wisdom teeth, and sort of that full scope comprehensive dentistry approach. Again, our focus is strictly in the lane of dental implants. And over those years, we've built a very robust offering on the training and education side as well. Through the Genesis local education platform, the center is approximately 15,000, 16,000 square feet of additional training and education, including a state-of-the-art simulation lab, which of course you've seen yourself. And it's outfitted with the latest and greatest in technology and innovation. So, and our goal there is to be able to give all of the learnings that we've established and the data that we've acquired over these years with all these wonderful cases, and really provide these solutions from a training education standpoint to the entire world. And it's not just specific to dentists, but we take a very holistic team approach in this because it's critical that the team is completely involved here, because everybody has roles and responsibilities in terms of success and how patients, ultimately receive this legendary type of service. Our methodologies and sort of mission here is in scope of, as you know, somewhat to the degree of the Mayo Clinic approach. So, as you know, Mayo Clinic is absolute fierce promoter of patient outcomes, absolute patient outcomes in medicine. For us, it's the Mayo Clinic approach, if you will, in all things dental implantology. And so there's never a situation where a clinician and their team would come to our facility for training and education and not have the journey for the rest of their career accessible to them. So oftentimes, doctors and their teams who participate in these programs are kind of connected to our community for the remaining portion of their career, which is really great. And the third pillar is build technology. And so taking those principles of immediacy, immediate principles, we've somewhat disrupted the world of construction in that same fashion, where if you can think about the digital workflows, if you will, in dentistry, where you would take a cone beam CT scan or an intraoral scan, acquiring data, if you will, and then putting that data into a software where you can manipulate the data and then produce something from there, whether it's printing it in 3D or milling a component or a framework, if you will. So in construction, what we've done is helping, again, staying in our lane, construction dental clinics, whether it's new construction projects from the ground up, whether it's rescues, if you will, of other construction projects, or simply renovation of an existing office. And we do this by leveraging the same sort of protocols. We have, using today's technology, something as simple as a mobile device where we take a few pictures of an office and then taking that information into software where we have the CAD computer-aided design files of everything from dental capital equipment to something as straightforward as a sofa and a chair, where the dentist can essentially, take their idea and bring it to life, incorporating the two-dimensional architectural drawings, and then they'll literally have a set of VR glasses that they'll put on and step into their new office for the very first time, seeing all the fine details before a hammer or a nail is kind of put into a piece of wood, so to speak. So it really allows dentists to really see something, as we say, bring their idea and their dream to life, and make sure that dream is seen right to the finish line and beyond with IT services and back-end support. Again, dentists helping other dentists, see things that otherwise they might not be looking out for, and all of these wonderful things that we're able to help with that as well. So hopefully that.
So the goal in being able to have, from what I understand, it was really to, help other dentists be able to do what you have been able to do at the Chrysalis clinic, right? So that they can take the courses, attend the Genesis Global Training Center, and if they want to take it one step further, they could also build an office or design an office so that they could also be as efficient and effective, because your offices are incredible. When you walk through and you see the flow through of it and how efficient they are, it's incredible. But I would assume that was the whole purpose, is you just started to see that, it's kind of the E-Myth philosophy, right? In terms of the systems, the processes and everything to make it easy to help other dentists, just like you said, dentists helping dentists. Is that correct?
Exactly. And, oftentimes they will see things here while they're participating in education, and they'll say, I'd like to have some of this or all of it, so to speak, at my scale. And so when we virtually construct this, that's kind of the appreciation that they have. The other thing too, Linda, is because we are dentists here, we're able to help them again identify with things that they might otherwise not be able to, are looking out for, so to speak. But also, as an example, construction, sometimes for dentists, they often ask us if there's any way that we can somewhat allow them to continue with cash flow and allowing patients to participate in treatment in their offices while construction is happening. So for us, because again, we understand patient flow, we're able to really map out this, a successful journey in this capacity. The nice thing is we also have the milling facility just kind of across the street here, where everything again is on the CAM side, so computer aided milling, where we mill cabinetry, we bend piping, we have lead ball fabrication, all of these wonderful things that once everything is completed, if you will, it's put into a container, it's shipped on site, and the construction team goes to work to piece it all together, millimeter by millimeter, if you will.
Right. Wow. Yeah, it's incredible. So I know myself building out offices, and we've done that in our own business a number of times. We had 8 at one point, and it's really hard when you're trying to make an existing space work, but especially like in a clinical practice, when you really need to maximize your space and it needs to be efficient, especially when you have a team and you're doing surgical procedures, to be able to work with an organization like yourself that's, I'm sure it's a highly sought after service, or, they wonder where can they go, now they know. So I hope we get some listeners that hear it and find it very valuable. Thank you for explaining that, Dino. So Brian, I know, you have 20 years of experience clinical practice as an oral maxillofacial surgeon. And, you mentioned for the last 5 years that you actually do surgery, do you not, for the Chrysalis group? Is that right?
I started doing surgery here, and then I've actually transitioned more to management of research projects. Okay. That turned into a very large endeavor. You have to think of us probably more on institutional terms than as an office. And as Dino's mentioned, we have a philosophy as well as a culture. And our culture is patients go first and everybody works as a team. So we're not strictly a return on investment kind of model. In the long run, yes, there will be huge return on investments. However, in the short term, it's all about improving the patient experience. And that's done through, one, validating what we do. And the concept, you've heard it before, teeth in a day. And that's a marketing mantra throughout North America. But the reality of it is many of the barriers for people are fear, finances, and an inability to get things done. And part of our protocols here are literally teeth in a day. You come with a tooth that has a problem. and is non-restorable, rather than going through a long, lengthy, costly procedure to have it replaced. You're in and out of here in a couple of hours, just as good as new, with something that looks fantastic, that functions, and if our data bears it out, is a lifelong, I won't say investment, but a lifelong solution. And this is what we're truly aiming for, to bring this to the larger market. There is nobody in dentistry that cannot provide this service. The barriers we need to overcome is to demonstrate that the techniques, the protocols are very learnable, and that they are backed by data. In dentistry, we have a problem that medicine and pharma doesn't have, and that's numbers. We tend to work not in an institutional kind of environment, but in a very partitioned off environment where every office is unique, which means patient numbers are small. And that data never gets collected because protocols change from office to office. We are different in that we have a vast database, literally in the tens of thousands. And that data, with the proper analysis, is going to yield very solid answers like you would have in medical procedures or phase 3 drug trials that will show you that this works and that it is beneficial to patients. And when it's beneficial to patients, it becomes a good return on investments. Through our teaching arm, we're able to then teach those techniques, cut through all of the baloney, and actually teach what's important in establishing first-rate healthcare for our patients. That's really what we're looking for across the board as healthcare providers.
And so that's why they call you the science guy, right? Involved in all the research. And you know what, that's true. And as you know, I came from a healthcare background. I was a nurse and I went into the medical device industry, and everything we did, and I was involved in disruptive technology, launching new products. And when we were doing that, the first thing that was always asked is the validation, right? The proof, the evidence-based medicine and what was there to support it. And if it wasn't there, they didn't do it in acute care settings. So it was collecting the data, making sure they had it, just the same as in the pharmaceutical industry. So I feel your pain. It is difficult if you don't have the data, and if you're trying to, help the dental industry and patient care, if you're able to do that and collect the data, you're miles ahead. And I think in the dental industry, it's important because, patients are now much more aware, they're educated, they're asking for treatments, and they want to know what's the validation, what's the proof I'm going to spend $30,000, $40,000 for whatever the treatment might be. They're an educated buyer now, right? So it's fantastic that you're doing that. So can you both maybe speak to your perspectives on what advantages, dental practice like that your group brings to dental practice startups, or even large organizations like DSOs, if they were to start to educate their practices and bring them through the Chrysalis training, and how they could differentiate themselves. Could you speak to that? Because, so many of them, they're off, just like you said, they're doing their own individual things. What's your perspective on how they could really differentiate themselves with their competitors from the training and the support that you provide, and, even, build outs or anything like that. But I think really it's the training initially that really could help them. And I think, Dino, you and I talked about that with their, if they have associates coming in, or they just even themselves wanted to train, and you recommended that they train and bring in their dental assistants or hygienists, well, not their hygienists or assistants actually, in the training, and how important that is. It's a team effort when it comes to the training. Can you speak to that?
Absolutely. So maybe I'll take it a step back and just give you some data in terms of the general marketplace as far as the opportunity goes. In Canada specifically today, for every 10,000 people in our country, where a dental implant is the standard of care, or should be the standard of care for missing teeth, there is less than 60 implants restored for those 10,000 people.
Wow.
And oftentimes when I share this information with people, it's quite surprising to them, because oftentimes dentists believe, like, depending on certain markets, it's a saturated sort of offering. And at the end of the day, it really comes down, the reason why this is such a low penetration, if you will, is because people just don't know what they don't know. And it's a combination of the patient, it's a combination of dentists and their teams. And so for us, we use words like evidence-based sort of medicine or evidence-based implantology. Our offering is truly evidence-based education. And what we try to do here is to entice the dental practitioner who engages in these forms of education, that it really is, like I mentioned before, a team approach. The treatment coordinator, who is oftentimes dealing with the patient up front and going through the barriers, as Dr. Freund mentioned here, time, pain, money, trust, fear, all of these walls that patients will put up within the practice, keeping them from saying yes to proposed treatment, is one area that we have trained teams on. Assistants who are going to participate next to the dentist and setting up the operatory strategically for success, to be prepared for a plan B or a plan C situation, to make the journey in terms of the surgery and the outcomes that efficient, is something we heavily train on. We, of course, train on the surgical aspect, but more importantly, everything that we teach comes from a top-down approach, prosthetically driven. I always say you don't necessarily build the roof of a house before you've had footings in place. Most construction, I hope they don't do that, but that's usually how it should be. So if you think about a dentist who just graduated school, they have all of these different things that they've been taught, and they don't necessarily have a structured onboarding strategy for success when it comes to the world of dental implantology. So we've laid out a program in various capacities that allow them to be successful this way. And as they onboard, say, something simple as managing existing teeth with an endodontic sort of program with Dr. Lenore Haas, or getting into veneers. And then as time goes on, their appetite to restore dental implants. The college here in Ontario requires 35 hours of prosthetic CE hours, as well as 15 CE hours on the surgical side. So we provide that curriculum. As the dentist becomes more comfortable, we take them into the actual additional surgical time that they require to place dental implants. As they desire to get into more complex cases like full arch rehabilitation and these sort of techniques, we have a program set up. So it's almost like a graduated licensing as well. But once they complete all of these various capacities of different education, guided surgery, we never leave them alone. They always have a direct line to continued mentorship. Oftentimes we'll have dentists who bring patients into the clinic. They'll do surgery under the mentorship and guidance of our robust clinical team, the in-house laboratory, support staff, all of these things. Because again, it's fierce promotion for absolute best outcomes for the patients. And in training the dental team together in this capacity allows them to be successful in this fashion. So conventional 7-8 visits down to 2 to 3 also help the patient streamlining their day-to-day and saving everybody a lot of time under ideal circumstances, of course. And I would say it's a beautiful thing. So hopefully that gave you a good perspective of how we approach things here.
Well, one of the things that, I noticed in coming to the office was the experience. And, when you have patients, you talk about the fear, you talk about money, you talk about time and all those sorts of things, and they're coming for a consult, they've been referred, say, and they're looking to get this done. the very first thing, it's experience, right? It's how people, the experience that people have when they're dealing with, especially in a situation where they have fear or they have doubt. And the minute you walk through your door, the experience is positive from every individual you come in contact with. And I've been at your office a couple of times for sure. Everybody is pleasant. It's a calming effect in the office. Everyone says hi. There is no tension. Even when you go like where the offices are, it's that experience. And I think that, alleviating that fear and how the procedure is done. And I don't know if Dr. Freund, if part of your research has also been around, results is for sure really important, but if it's also how that impacts people in terms of their response and their healing, or their, is any of that taken into effect in terms of research? Do you look at that?
We are collecting data on it.
Okay.
As Dino mentioned, Chrysalis as an institution has a cultural underpinning to it. And we try to make the experience of everybody, whether it's a patient or a dentist who's coming for training, to be a very positive event, as you said. Think of us as the top gun of dental training and implantology. We truly have some of the best here. And this is not to blow our own horns, but this environment attracts talent. And with that comes better patient outcomes. We're not in it overall this is not the intention of going on this scale was not to make money, but rather to share. Money comes from excellence. And if we can pass this excellence on to everybody, from the patient level, from a staff level, right through to other specialists, we are going to help everybody. And that makes it beneficial for the entire industry. And truly, what we're looking for through our offerings in education is not just to be one-sided, but to offer people educational experience on the business side, whether they're young, whether they have an office that isn't going to work. On the clinical side, not just on implants, but we offer training in neuromodulators like Botox. As Dino mentioned, root canal therapy for people who aren't quite at the implant stage yet, and how to integrate this into a successful practice so that your patients really come out on top. And that's what's going to generate the differentiation and ultimately the bottom line of practice.
And it's interesting because we recruit all sorts of different roles within the life sciences industry, and one of the biggest challenges we have is organizations that haven't quite figured that out in terms of the impact of culture. And if you don't have great culture, it's at the top, it's the leaders, right? And in terms of leadership, how they value their talent, and you talk about you attract the best of the best. And the reason you've been able to do that is that culture that you've built. And also they're attracted to want to build your business because they see that you're, Top Gun, you're the best organization in terms of wanting to help your customer base, the patients, etc. And when you have a great product or service and you have good systems and processes, it attracts the best talent out there. And so, if you're looking for hygienists, or you're looking for dental assistants, or you're looking for any support individuals or dentists for that matter, they want to come to your organization. And that's something, I try to explain to my clients when they're saying, we can't find talent and we don't know why that is. We can't seem to attract anybody. I try to explain to them, we need to look at everything. Where are the issues? What's happening with your culture? And, that's something I noticed immediately about your organization. I could feel it. I wasn't sure what was happening. So, when I had conversations with Dino and I talked to him about your organization, I think that that's something that you should be very proud of, besides being expert and really have identified a great way to do implants, and the fact that you're a dentist helping dentists. It's the whole vision that you've had for your practice. What do you think? Where did that come from? Was that Dr. Bongard? Was it the whole leadership team? What was the beginning? What sparked that, do you think? Where did it come from?
Yeah, I think it's definitely, let me say it maybe this way. As I mentioned, having just recently joined the amazing team here at Genesis and Chrysalis, I personally always believed, Linda, I guess you know me like this as well. For me, culture is everything. I use the word family all of the time because it's my truth. I think that organizations today, the most successful organizations, really have that word embedded into their fabric, meaning that all people who participate in their day-to-day activities as employees of an organization always want to feel like they belong to something that's even greater than what they stand for on their own, a place where they are felt welcome, where they feel safe, where they feel that their ideas and thoughts will never be discounted, that everything is on the table in terms of, the promotion, whatever it is that they're fighting for. In our case, as mentioned here, the absolute outcomes for the patient. When I first met Dr. Stephen Bongard years ago, it was a perfect marriage because, in my belief, this is what he's done over these 25 plus years. And here today, this is the engine, if you will, that drives the energy, the motivation, the inspiration, the care, all of these things, as Dr. Freund mentioned, in how we do things on a daily basis, whether it's the patient always up front or the dentists and the teams that participate in education, even our customers on the build technology side of things. It's all of that. Yeah, right. Add to that.
Very much along the same lines as Dino mentioned, to be able to attract people into a culture is one thing, but the group we have assembled here has a fierce loyalty to the trajectory of or the concepts of the practice. Everybody's on board. There is amazingly little or no ego that goes with this kind of culture. There's no corporate backstabbing. It is, everybody is working towards goal. And it's like being in a family where everybody gets along. Is almost as silly as that sounds. That's what we are. And that's what makes the visiting dentist as well as the patient experience so unique when you walk through the doors. As you said, you can feel it when you're in here. And I've worked many practices, several of my own over the years. And I've got to say, the last 5 years it's been a joy to come to work. And I can't say that from having been in other practices. It truly works, and that allows us to give back in a very effective way. And we continue to do so, and continue to look in innovative ways to improve what we can give back more effectively. And we are being very successful at that. What you saw and what you have seen, this didn't just happen by accident. And outsiders come in very often and go, well, yeah, it's easy for you. Look at the facility you have and look at the people you have. That was a long climb to get here. And it continues on its own. Same as people say, well, look at Apple. Of course, they're a world leader. Didn't start that way. It started with a dream. And that goes back to Dr. Bongard, who's knack is to innovate, not only in procedures and concepts, but to have the vision, to have the right people around. And that's what allows us to continue.
And you know what, it's, thank you for making that point, because I've owned my own business, as you know, and I've been doing this 22 years. And I've had different divisions, different companies, and lots of employees, and it's not an easy gig, I'll tell you. So I appreciate exactly what you're talking about, and having the vision and building the team, and having great culture and really working towards that. But you know, when you are developing products and services, and you have customers you're looking after, as well as, you know, wanting to build a great culture and a team, it is tough. And when a lot of individuals don't understand how difficult that is, and, you know, kudos to your organization for doing that. And I know a lot of entrepreneurs that have started very successful businesses and sometimes struggle exactly with the culture part, because sometimes they're so busy building the business and the service or the products that they have, and totally forget the culture part, and they have lots of turnover, lots of issues, and then it affects the business and they start to struggle. So it's so important to be doing both at the same time. And it, you know, speaking to that, how do you think you've done that? What is it that, like, how have you done it intentionally? What has been the secret, do you think? Can you speak to that? Do you know what that has been? Has it been the systems and processes? Has it been specific people that have been in charge of that? What has actually allowed you to be able to build both at the same time?
Sure. I think a lot of the success has been the organization of pillar champions amongst all divisions of the organization, who are in leadership positions, who absolutely believe in and live these concepts every day. On the coaching side, that's what leadership truly should always be, in my opinion. Coaching is not one direction. Coaching is in every direction. Just because somebody like Dino might be the head of operations, what does that actually mean? It's not sure, there's certain responsibilities in that role, but more importantly, with working with each of the division champions and the teams, that, you know, we have to have an open mind always. We have to be listening for the sake of listening to what our people are telling us, who are experts in their field and scope of work. Only then can we remove any potential assumptions that we might have, but rather engage in all the right information that we should be looking for, because from that information and trusting our people is what makes us better, because we can adapt to the changes that we need to make quite quickly and move forward, always moving forward. So that's the best way that I would explain it on my side. And if you want to.
We network both internally and externally. We have to understand our marketplace, and that requires a lot of insight. And because we wear different hats when we're here, the ability to exchange ideas and to be nimble, as Dino says, to adapt to change is extremely important. And we are nimble, if nothing else. We are not a monolithic institution where we're not a bank.
Yeah, thank goodness.
This is the way it's done. And this has been the problem with dentistry in particular. Dentists are small businessmen. They have bottom lines, and there's the tendency to have to look at the end of every day at your production to see if you're going to do it. And that is counterproductive in the long term, because that takes away from the global concept of provide excellence. Even if you didn't make as much money today, but you took care of your people, you're going to make more tomorrow. And this is part of what we try to instill through our educational networking and our practice networking, that we can help people realize their goals And at the same time, they feed back to us so that we understand what the needs are, not just in a microcosm, this corner that I work on, but rather the industry as a whole. And that's what kind of makes us unique.
Well, and to your point, but dentists, and you're one, that you're a clinician. You wanted to serve patients, right? Treat patients. So they open up a practice, or they think, it's great, I'm going to have my own practice, but they don't realize, nor are they taught how to run a business. You see that in chiros, you see that with plastics, ophthalmologists, and dentists. I see it all the time. And they're hiring staff, and they're challenged with, people management, they're challenged with financial obligations. But what they really wanted to do was practice and look after patients. And they're just pulled in so many different ways. It's so stressful for them. Now there's the odd entrepreneur that became a clinician, and they can manage, and it's not they can thrive in the business environment, but that's few and far between. And there are so many that need the help that you provide and could really flourish under the guidance of others that have the systems and processes and the knowledge and the coaching that you offer. What would the next steps be for them? How would they reach out to get the assistance from your organization? What are the steps? Do they go onto your website? Is there somebody to call? Like, what would a practice do that is considering a program you have, or getting some coaching?
Yeah, it's a combination. We leverage various different platforms. Social media is a big one. Doing the different, Instagrams and LinkedIn's and whatnot. But we also have a pretty robust landing page, genesiseducation.ca. But we also have a global partnership with Strong Group Global. So the field sales team is actively always promoting programs. They keep themselves up to speed with what's coming next in the platforms of education, how it sort of helps their customers succeed in terms of what they identify as gaps to their goals as well. Oftentimes, dentists who have been through our education in the past, who have now acquired a second, third, a fourth clinic, so to speak, onboarded new dentists, new dental associates. It's kind of this constant evolution in this cycle of, again, I used the word community earlier on, and that's what it is. They're part of something that, that they can lean on and connect with at any given point of running their organization and their team. So, again, it's one other thing that we also are quite sort of fierce promoters of is third-party services, so to speak, that dentists might be working with, meaning, dental laboratories, denturists that are helping them as well. Because when you unite people, Linda, and you bring everybody together, it really helps them understand a strategic way forward. And here, when they leave, so to speak, they actually have a plan that involves all of them doing everything together. Everybody, as I mentioned, has a role of responsibility. So come Monday morning, when they get back to their offices, it's quickly implemented, that they're not, limited by sort of the lowest common denominator that wasn't educated on a particular process forward, so to speak.
Excellent. And from a research perspective, and Dr. Freund, what are some of the research that you're doing next, or maybe that you're continuing doing, that are sort of up next for you?
We are looking at, our emphasis at the moment is protocols involved in placing immediate implants. In other words, tooth goes out, an implant with a crown goes on, and you have function that day. In other words, no downtime from a dental perspective. to do it cost effectively, and to do it painlessly. So that's what we're really looking for. And those protocols are somewhat diverse at the moment if you look at on a worldwide scale, with a lot of argument and infighting. My way's better. No, my way's better. And
of course,
yeah. Statistics allows you to demonstrate anything. The difficulty we have in dentistry are the numbers are low. You have protocols that support or that are supported by studies with literally half a dozen patients. You know, would you have a heart valve transplanted if it's backed by a whole 12 patients? You know, this is what we're dealing with. So we are trying to up the game and take advantage of the tens of thousands of patients we literally have to extract data from, and increase the amount of data we collect on each new patient that comes in, from an experiential point of view right through to clinical details, so that will go into a searchable database that we will actually be able to do high quality clinical studies with. And this is the emphasis. The real new perspective we're going to bring to this is we're using artificial intelligence to start helping us to both mine and analyze the data. And although AI has been available on a number of, we've all talked to chatbots when we try to get customer service, but there's more to it than that. You can train these algorithms to extract data in a very consistent way, in a very timely way, and in a very economical way. And this will allow us to bring to the market high quality results in fairly short order. And that's our emphasis at the moment.
And that is a procedure that you have refined, if I'm not incorrect, that you currently do now, right?
Absolutely.
In your clinic, yeah. And it's something that you have best practice and teach as well, right? In the center, yeah.
Yes, we are the protocols on best evidence that we have at the moment are well supported, not just with our data, but with others' data, which we are looking at augmenting. And those are protocols which we teach and hopefully allow others to share our enormous success rate.
Right.
To take it to their patients.
Right. Excellent. Because I know, I've talked to so many people that have had implants and they're like 6 weeks or 3 months before they're completed their whole procedure because everything that has to be done. And when I tell them, oh, geez, and I explain that they could have come to the Chrysalis clinic and maybe it could have been shorter. They're like, what? So I think that there's lots of education out there that they're not aware that it can possibly be done. I'm sure that there's not every case, maybe, I don't know, but that's if more dentists were trained on the procedure or aware of referring to your clinic, that a lot of patients would be happy. One of the questions I wanted to ask too is that, Dino, in conversations we've had, that, the objective of your team is, upping the game and bringing the dental clinic to the next level of excellence, like the Mayo Clinic of dental. Can you expand just, in closing, what that really means so that people know what the next level is? What do you mean?
No, it's a great question. So there's so many different arms to this business model here, where anybody and everybody who's engaging in sort of the day-to-day operations really knows that we never make any assumptions, so to speak. So, if there's something that we're discovering in any capacity, that we take the time to collaborate as a team, for sure. We have routine lead team meetings, we have routine team meetings. We're constantly in three parts. A, reflecting on what the past kind of looked like. So maybe it's over the course of a week, a month, or a quarter. You know, what went well, what didn't go so well. The second part of that is, okay, what can we control today? What adjustments, if you will, based on those learnings, do we have to make? And then what does future progress look like? And so everybody has skin in this game. Everybody has responsibility, and it, quite frankly, it's quite exciting. You know, when as I mentioned earlier, when you let people do their job, do their thing that they're really good at, it means it's a different type of energy that comes with that, and a feeling, as I mentioned, of belonging. And so we really structure it this way. And you know, something that Dr. Freund might be looking at, which would be in a world that it'd be very difficult for me to understand, or what I'm doing on a day-to-day basis. At some point, we combine those thoughts and those ideas, and then it sparks, you know, something that was never there before. And again, all of this is on that journey to make sure that our patients and our participants in courses and these things are always getting the best of the best in terms of experience and outcome. So hopefully that makes sense.
Yes. Dr. Freund, anything you wanted to add to that?
Just to emphasize really the three-pillar model that we're using, that we clinical excellence in terms of high quality service using high quality components and best techniques, the ability to educate individuals, be they dentists, staff members, in these techniques in order that they can truly enhance their own success, their own practices in their own environment, and then do the research that will back up everything and say it sits on a solid foundation. This is not just a fly-by-night concept to be superseded next week by the next flavor. That what we're doing is solid and it's here to stay, and you can have it in your practice as well. We're happy to teach it to you. None of this research, unlike, you know, the pharmaceutical industry, is hidden, is going to be sold as data. This is going to be made freely available in real peer-reviewed journals for everybody to look at and say, yeah, this works, or how about doing this better? And the idea is to bring the playing field, the whole level of the game, up to a better level.
It's
I think I was just going to add, Linda, I think what's also important here is to talk about the vendors with whom we work with as well. You know, different people within our organization are much more experts, if you will, with different vendors that we work with and their product offerings and solutions. But it's equally as important that the vendors that we work with also believe and I would say trust in sort of why we do what we do, but also are connected to our core values, as we've been talking about here. It just makes life easier that way, and certainly leads to less disruption as the ball continues to move forward here. Yeah, very important for us. And it's something that I would highlight to others who are listening here, that, you know, to audit that. Maybe, you know, maybe look at the companies that you're working with. Do they believe in what you believe in? Do they have the same ambitions? And it just makes the connectivity and the partnership that much more fluid and promising.
Actually, that's a good point, because if you have vendors that don't, and it interrupts your ability to just do what Dr. Freund talked about in terms of being able to deliver to the patients or to provide the quality, you can't accomplish the high level of service and implantology you're trying to commit to. So that makes it very difficult. So yeah, it doesn't matter what service provider you have, you need those commitments, right? And it doesn't always come down to price. It comes down to the quality of service and commitment you're going to get from them. And sometimes we get caught up in the price of things, right? So we really have to validate really what's behind the company. So it's a good point. But I really like the the concept, and because I've worked in the life sciences for so long, I very much understand what you're talking about being guarded, not sharing, and not, educating everybody once we know what best practice or different what different products can do for patients, because everybody wins. And that's what we're doing in healthcare is trying to better the outcomes of patients and the quality of life for everybody, whether it be quality of life or better treatments, and also for the healthcare practitioners, their day-to-day lives as well, in terms of how they care for patients. So your philosophy overall is just so different and innovative, and I think that's what differentiates you, and that's what makes you better, not just from what the treatment is that you provide, but your overall perspective of giving, just like you said earlier in our conversation, dentists helping other dentists. So you're not just helping patients, you're also helping the other dentists within your industry. So, that's why I really was anxious to, spread the word and talk to you on our podcast and let others hear your story. And Chrysalis has really done a great job, and it's nice to see people passionate about what they do, because I'm very passionate about what I do. So I want to share that with everybody. So thank you so much, both of you, for joining. And if there's any information you want to share about your organization at this point, other than what we've already shared in terms of websites or company information of any of the groups, please let me know, like the Build a Renovation or Chrysalis Training. Is there anything you'd like to add?
I think on my side, I always encourage certainly industry professionals. Linda, I know you know a lot of people out there as well. But anybody, again, listening here that is maybe intrigued by this conversation and kind of what we talked about here, and would ever want to visit the facility in person and have sort of a private tour and get a better, clear sort of in-person understanding of how all of this kind of flows, by all means, they can reach out to you, or they can contact us through the genesiseducation.ca website. Personally speaking, I'd be more than happy to, I do this often for, it's not always necessarily just dentists and their teams. I could be, somebody who's in the cone beam CT field, or in any sort of aspects. I've even had people in here that are in the construction industry. Sometimes we even had just normal people that have just out of sheer curiosity walking the building, and we just kind of give them a tour. So we're open to everybody to discover, so to speak, if you will. And so I guess I'll just leave it at that. But, feel free in any capacity for anybody and everyone to kind of make a connection, and we'll do our best to show them, again, what we do, why we do it, and maybe what's in it for them as well, potentially as patients or as clinicians.
Well, thank you. And I can say, speaking from experience, I highly recommend that anyone that's interested in improving their practice or looking for different ways to do their implants, they definitely want to tour your facility. It will be an eye-opening experience. That is for sure. And from a culture perspective, if they are having trouble with their own cultures and hiring and that sort of thing, they want to talk to you in terms of what it is you've done different, because that's a game changer. And of course, I can help them with that a little bit too. But most importantly, you're an example of best practice. So, congrats to both of you for being a part of that. And thank you so much for joining us. I really appreciate it. And, we'll be seeing you again soon, I'm sure.
Yeah, thank you, Linda, as well. On behalf of Dr.